The patients who have portal hypertension usually present with one of two ways. They have enlargement of the spleen, and that can happen sometimes from a very early age, less than 1 year often. And the other symptom, which can be very dramatic, is the vomiting of blood. There's a lot of misconceptions about this disease and a lot of big gaps in people's knowledge. It's not a common disease, so it's not like something that if you're a primary care doctor you're going to be seeing every week. You may see one child in your entire professional life, and so when you get to that sort of scarcity, any primary care doctor may not really be able to know at his or her fingertips what the best procedure is. When there's enlargement of the spleen, silent enlargement of the spleen, sometimes the cause of this enlargement is not immediately obvious, and so other reasons are looked for. Tumors, lymphomas, malignant disease is often looked for. And sometimes when that is not found, some time passes on before the definitive diagnosis is made. In some of those children, because the spleen sometimes tends to enlarge more and more and more, they'll usually come back to somebody's attention over the course of the next few years, in the early years of the child's life, and inevitably they will be re-imaged and the diagnosis will be made. If a child presents with bleeding, then I think that's much more readily suggests the diagnosis of something wrong with the portal vein or portal hypertension of the liver. And usually people focus on the portal vein, and with modern day imaging, it's not that difficult to make the diagnosis with an abdominal ultrasound or a CT scan. So usually children, in our experience, present with this very early on in life. We've had as young as 3 months old, and then we've had others who present as adolescents in their teenage years. So they come in all shapes and sizes, but most of the patients who come to us have been symptomatic for a number of years. There's usually a lag of about 4 to 5 years between the onset of the symptoms and the time that they're referred to us. And that's not to say that nothing has been done in that time. Sometimes, particularly if someone has bleeding, then clearly doctors who are looking after that patient will try to address that with therapies that are aimed at obliteration of the varices that are causing the bleeding, such as injection with solutions that cause the varices to disappear, or sometimes the varices are banded. Sometimes patients are given medication that will decrease the chances of bleeding. But inevitably, the symptoms will often progress, and even if the bleeding doesn't, the spleen usually enlarges more and more. And then that causes a whole raft of other symptoms. Children are prevented from playing their favorite sports because of the fear of splenic injury. The spleen enlarges, and so patients' platelet counts and white blood counts will diminish. And so, at some point, people feel like, well, you just can't sit on this. We've got to do something. And at that point, you really will trigger the referral.